Hey guys, welcome back to Quick Nursing Shorts. It's Mita, and today I'm gonna give you pro tips how to write a long essay questions for nursing examination to get as much as high score. So here I have put outline over here. So it has a definition, etiology and risk factors, incidence and prevalence, followed by pathophysiology, clinical manifestation, assessment and diagnostic criteria, and last but not the least, it is management. So management will be again subdivided into medical management, surgical management, and nursing management. Okay, so what are these things? One, two, three, four, what I have written here, it's the score. Okay, so this outline is actually based on how you are assessed, okay, for 10 marks. So these are the score you'll be getting for each subheading. So here you can see I have not written for incidents because basically etiology and incidents we are writing together. So here you'll be getting one if you write both correctly. And so the major mark is given for management. Why? Because the management is the most important part of your 10 marks answer. And again, because management has this medical, surgical, and nursing management, and being a nursing management is your utmost priority, right? So basically from this 4 mark, directly 2 and 3 marks are going to your nursing management and nursing diagnosis. So do remember and keep this criteria in your mind when you are writing your 10 marks question. Okay, so definition says that start your definition with two relevant and accurate definitions. Okay, always try writing definitions by those who which is certified, or maybe by those who are given by some known authors, or from very big books, or maybe some famous book it is coming from. So always try and prefer those kind of definitions. Do not write your own definition, because a 10 marks question is anyway starting with the definition part. So if your definition itself is your own word, so the examiner will not take that much interest in your paper. Okay, so start your definition with this. Then etiology. So etiology, don't write whatever your mind is saying. Okay, so always start with the main reasons, main causes of this problem, and then divide these causes under some different subheadings. So why I'm saying like different subheadings, so you can just make like these headings if it is if it can be possible. Then okay, like making some physical causes, then biological or hereditary causes, or environmental and social causes, and there can be like this many more okay subheadings. If you want, you can just put it like this, and then your answer sheet will be looking more attractive than any other student. Then always draw some relevant pictures and related pictures, so it will actually make it more attractive. By pictures I mean you can just draw by a pencil. So take your pencil or pen, and then just write any relevant diagram. Just imagine if you are writing over pancreatitis, so you can just draw a pancreas when you're writing etiology, and just make a rough picture of pancreas, and in that picture itself, in that you just write some reasons and etiologies. Okay, you can point out it there. If it is something, some GI disorders, then just try drawing some intestine, and in that intestine lumen you can write your points, what all the causes you want. And you can also draw liver if it is about liver cirrhosis or maybe some other liver problems. So like that. So these are the ideas which I have given you. So always try drawing some pictures, because it actually makes it more and more attractive, okay, for the examiner. And it will catch their eye, and you're gonna get definitely one marks for all these things. Definitely you'll get it. Okay, so moving on to the incidents. So preferably, because we are Indians, so here we will prefer writing Indians rate of disease. Okay, in at what rate in India this disease is happening, and global rate, and like on a global page how it is being affected. Then pathophysiology. Pathophysiology is not something which you can write like a description. No, avoid that. Instead, you can have a flow chart. So always write a pathophysiology in a flow chart way. Then it should have a clear meaning. Okay, so you don't write whatever in a vague manner. You can write something which is relevant and which has a meaning in maybe in one or two words. Okay, that's more than enough, but it should actually have a meaning. Okay, so this could be written in your own words. You can write it in your own words, but it must be having some meaning. Okay, so you know pathophysiology, what it is. It is a mechanism how the problem is causing and how the problem is spreading. So write in that manner. Then here also I will give you a tip of drawing some related pictures. Okay, you can have if you are writing something about gallbladder, so try putting picture of gallbladder. Okay, and then just give it some shades, and you know this will definitely, it will attract your examiner eye, and you're gonna get good marks on that. So clinical manifestations, in clinical manifestation, as we know that we have seen a lot of common symptoms like vomiting, diarrhea, or abdominal pain, blah 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 blah. So do not write those kind of symptoms. Okay, start with the classical signs and symptoms, because in any disease, in just take on any disease. Okay, every disease have some classical symptoms. So these classic, based on these classical symptoms only, we are actually diagnosing the person what diagnosis they have. So always start with the classical signs and symptoms, and then from there you can move to the basic symptoms or maybe some common symptoms, and try writing some relevant symptoms. Okay, not like the person, like the disorder is something related to your stomach, but you are writing symptoms of your lungs problem. Okay, so always have some relevancy when you are writing about clinical manifestation. So assessment and diagnostic criteria. So assessment and diagnostic criteria, although it contains only 1 mark, but I'm gonna tell you guys, always start with history collection and physical examination. So these two these 2 points, first of all, to these 2 points will be a kind of weightage. Okay, so this will weigh more when you're writing something. And then move on to the relevant studies, like whatever study is actually appropriate in that condition, and what are the main studies by which it can be diagnosed. Okay, so there are some tests or maybe there are some diagnostic criteria, so you can mention that. And from there you just come on to the common studies which we do, like blood investigation, we do CBC, we do endoscopy or colonoscopy or x-ray, CT scan, MRI. So these are the common exams, or we write in any disease condition. Okay, so come to the management part, as your management has 4 marks. Okay, 4 marks. So here you will be having your 2 marks is directly here. Okay, 1 marks is here, 1 mark is here. In case surgical management is not there, then that mark will also go to your nursing management. Okay, so medical management is something you are writing about medical treatment, like some medicine prescription, about some procedures. And surgical management will be definitely about some surgeries. Then comes your nursing management. In nursing management, always try enhancing nursing responsibilities. Okay, rather than just writing some kind of medical management. No, nursing management is completely different than your medical management and surgical management. So always try nursing management. Okay, so in your foundation you have learned a lot of nursing responsibility. Try putting those responsibility in here in nursing management. Okay, so a good mark will be achieved if it is about a surgery or something. Then you can just divide it into pre-operative or post-operative management. Then you can write pre-operative nursing management, and then after that you can just write post-operative management. Okay, so this will actually give you more content, and also the examiner will feel that yeah, as a nurse you are putting your more stress and on your nursing management. Okay, and then at last you have to write nursing diagnosis. So I would say always try writing five nursing diagnoses if possible. In that, your three or the starting four nursing diagnoses should be relevant to that condition, and then the fifth or sixth condition you can just write like deficient knowledge or anxiety or maybe risk for infection or anything, okay, like these. But your initial diagnosis must be like imbalanced nutrition, less than body requirement, or maybe imbalance, or maybe skin integrity, or you can write acute pain. So these are the relevant nursing diagnosis, okay, you should start with. Not like writing deficient knowledge in at second point. No, do not do that, because even your nursing diagnosis carries mark, okay. So this is it about your 10 marks question. So if you write in this manner, you're gonna get good marks, okay. So thank you for watching my video. If you have any other queries or you have any doubt, just comment down in the comment section. I will be coming with the solution of it. So study well. Bye bye.